Good morning and welcome to this meeting of the Board of Commissioners. We'll call this meeting to order, and let's have our roll call.
I can't see it.
Just need you, Ms. Ward, to confirm.
Did it take?
It did, and everybody is marked present.
All right, thank you. Let's stand for our invocation and our pledge. Mr. Hammond.
Let us pray. Eternal God, we are grateful and thankful for this another beautiful day and for the many, many blessings of life. We pray that Thou would guide us today as we go about the business of Pitt County. Bless us individually and collectively, and keep us ever in your care and keeping, Lord. Amen.
Amen.
Pledge allegiance to the
flag
of the
United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And bless Miss Mary. Brother Perkins.
I have a motion on the agenda.
Mr. Chairman, there's one item to add.
Okay.
It's been requested to have a report from DSS regarding the NC Fast progress, particularly around the Medicaid case backlog.
Does that motion include the amended agenda? All right, let's vote. Any motion on that certificate?
Yes.
Okay, and that's unanimous.
Thank you. I'll now entertain a motion on the presentation we're about.
So moved.
Second it. Is yours?
I done voted. Screen ain't on, so I couldn't tell it.
Mr. Hammond?
You'll vote.
This morning, the Pitt County Board of Commissioners is proud to issue and award a certificate of appreciation. If we can ask Benjamin Bullock and his mother to come forward.
I'll get right.
Come on. Mr. Chairman, would you like me to read this?
Please.
There's a lot of detail that goes with this, but I think once I read the certificate, we'll realize what we're awarding and recognizing, and then we can ask Benjamin to make any comments, or his mother, if that's okay. Certificate of appreciation is awarded to Benjamin Bullock for his appointment in service as United States Senate page in 2014. And this certificate is being presented, obviously, by the Pitt County Board of Commissioners the second day of February 2015, signed by our chairman, Glenn Webb. And we'd just like to recognize this. And Mr. Chairman, if you'd like to present this, make any comments.
Thank you. Thank you for representing Pitt County.
I can see you vote.
Obviously, we're always excited about our young people. We have a lot of Eagle Scouts that we recognize. Now we have a Senate page that we recognize. And I was able to talk to him a little bit before the meeting, and he has big future plans as well with his education and future. And we're very proud to have a young man of this caliber in Pitt County representing us, not just here at home, but nationwide. And turn it over to y'all if you want to make any comments.
I would just like to thank y'all on recognizing me for my service as a United States Senate page. And that's it.
Tell them about your college plans.
Well, after graduating high school, I look forward to going to West Point. If I don't get into West Point, I look forward to going to Hampton-Sydney, hopefully, except I like to keep my options open. And I'm applying to other colleges as well, but I'm really looking forward to going to West Point.
That's great. Mom, we know you're proud. Do you have anything?
What high school?
Which is in District 6, by the way.
But they got started in District 4 and 5, in middle school and elementary.
We just thank you so much for honoring, the county honoring Benjamin on his service and appointment to the United States Senate. It is such an honor to be able to be recognized at such a young age and be appointed and have a commitment to public service at such a young age, nationally and on behalf of the state of North Carolina. He served in a bipartisan role in the Senate, and we're so very proud of him. And that's what my husband Stefan and I have always taught our sons, is to have a commitment to their communities, as well as be civic-minded and civically responsible. So with that, we thank you again.
Thank you.
Thank you so much.
All right, next we'll have our public addresses to the board. Mr. Manager, we have anybody signed up?
Yes, we have two people this morning. The first person is Mr. Joseph, I believe it says Miller.
If you'll come forward, Madam Attorney, if you'll remind us of the policy on public address.
Yes, Pitt County Commissioners welcome all comments on matters of public concern. We ask that you keep all comments respectful, and I will keep your time at 3 minutes.
Thank you.
Thank you.
Morning.
I have something for each of you. Can I give you these?
You understand you can't get these back.
That's fine. So I'll put so many. So I'm kind of here to talk to you because you appoint 2 members to the Board of Greenville Utilities.
Thank you.
I have a solar system on my house that I've had on for about 5 years now. And I've been able to enjoy some nice benefits from selling the solar renewable energy credits. My contract to sell these renewable energy credits has expired, and I no longer enjoy as much of a benefit as I'd had before. And I've been trying to get something called net metering started in Greenville. Most of the country offers this, and as far as I can tell, every regulatory body that oversees electric powers, utilities, mandates it or requires it. In April of this past year, I went and spoke at Greenville Utilities at a board meeting requesting them to start it. Tony Cannon said they were doing a rate study last summer, which was going to consider the start of net metering. They did not offer it. At this point, there's probably 15 to 20 homes in the GUC service area with solar photovoltaic systems. 4 or 5 of these are probably beyond the contract where we get to sell our renewable energy credits. And we really need net metering. The way GUC handles solar systems right now is on a buy all, sell all system. I buy all my power from GUC on one meter, and what I generate, I sell back to them on another. I buy at retail and sell at wholesale. And if I design a system to serve my needs, I still have to pay the spread. It's kind of unfair. It's not right. It doesn't support solar in the area. It doesn't make sense for anyone else in the GUC area to put a solar system on without this. I know you have a board appointment coming up, I believe, in June with Ms. Hardy. And Joe Butler, I'm not sure when his term expires. In one spot I saw it was 2014 and 2017. I think we need to get net metering in the area to support renewable energy, decrease the needs of coal and nuclear power for generation. I've got a neighbor who's considering solar, and when I talk to him about how net metering's not available, he's not going to put a system on. The objections of GUC and other utilities probably comes from, if I'm not paying them for maintenance of the system, the rest of the area has to pay my fair share. There are solutions out there right now that GUC can implement, or recognize that 4 or 5 homes right now isn't going to amount to much of a change, and adapt in the future and come up with other policies.
Thank you, sir.
Any questions?
Anyone have any questions? Thank you.
Thank you.
Okay, next we have Brenda Harris.
Morning.
Good morning, I'm Brenda Harris. My address is on file. I want to speak to you today. I had a zip drive, but it's not compatible with the system today. But it's on the illegal foreclosures that are being done in our state court. There are several kinds of foreclosures. In realm is what we do when it comes to tax foreclosures, which I've been telling you have been illegal for a long time because of the Civil Rights Act and the fact that we use the lowest hanging fruit. That means we target the elderly and the disabled. But most people don't understand foreclosures and how it applies to the deeds of trust, which is a mortgage. And that's under General Statute 45 and 47, which it applies to debt on a mortgage or real estate, and it also applies to how you would collect it. Now, what we're seeing is that there was a company called Rogers, Townsend and Thomas. And the reason I got involved is I bought a farm and found that there was a jurisdictional law violation. You see, when you're passing title to somebody, you've got to do it so it's jurisdictionally correct, or the deed of trust doesn't have any teeth. And so someone like BB&T would come in and say, oh, but we have a debt on it. But you have to understand, if it was built on a farm, if it were a farm, septic, everything, every approval was a farm, and taxes were paid 10 years as a farm. The only thing a foreclosure can do is to take it from what it was before that deed of trust came about. And so when we allow attorneys to violate the law, and we allow our clerk of court, Sarah Beth Rhodes, to ignore federal law, what we're doing is indicting Pitt County again. We have septics that are absolutely bad, and it was done for good old Senator Warren during his day. But you don't build huge houses in Stokes, folks. And when you look at this, one of these big houses that the septic has not been put in yet, but it's for a 6-bedroom, shouldn't have perked for a 3-bedroom. And when you start looking at the things that we're doing wrong as a county, I've come to Ms. Gallagher. We've talked about it, and you know her philosophy is, well, you've got to file a lawsuit. Folks, that isn't what Thomas Perez with the Department of Civil Rights, U.S. Department of Government. Mr. Webb, aren't you on the state board as a chairman of some sort? Do you really want to be able to go to state meetings and say, you know, we're doing illegal foreclosures? 5 attorneys left that law firm, folks. 5 attorneys. That was mid-2012 because I blew the whistle. So what I'm saying to you,
Thank you, Ms. Harris.
you didn't do that a while ago. Isn't it wonderful that you
Yes, I
have
did.
2 different rules? Mr. Webb, I
Thank
am
you, Ms. Harris.
You can treat me with respect,
I
Mr.
did.
Webb.
I said thank you. Anyone else that wishes to address the board? All right, Mr. Manager.
Yes, sir. Under items to report, several items to report to you on. Your next meeting dates, in February will be the 3rd Monday, February 16th, and that'll be a 6 p.m. meeting, and then in March, Monday the 2nd at 9 a.m. I want to remind the board, I believe we have those who are going to attend the NACO, which is the National Association of County Commissioners Legislative Conference in Washington, D.C. That'll be February 21st through 25th. And then item C is a statewide meeting of the NCACC, the North Carolina Association of County Commissioners. This will be their strategic planning meeting. They're holding several of these across the state. We'll be having one here in Pitt County on March the 12th from 5:30 to 8 at the Hilton. And I know we've got, I believe, management team is signed up for this, as well as, I'm sure, obviously, Chairman Webb and other commissioners. If you're interested in attending this, if you'll let the clerk or me know, we'll get you signed up for this. Item D is another state association meeting. This is going to be a district meeting. This will be March 25th. This will be held in Martin County at the Senator Bob Martin Agricultural Center, again, 5:30 to 8. And I believe both of these include dinner, don't they?
Yes.
And then item E on the list of items The Health Department asked me to just announce to the board regarding the way they process death certificates. Right now, basically, if a funeral home brings in the paperwork for a death certificate, the death certificate is pretty much processed and handled in the same day. There's only certain individuals who are authorized or certified to do that in the department. One of the things they're experiencing is because they do turn these around in the same day that sometimes they're done too quickly and all the information is not there that needs to be there, or errors are being made by staff. Had provided to the board, we've got a long PowerPoint that explains how the Board of Health and the staff at the Health Department are proposing to have a 24-hour delay, that these would be issued the next day and not the same day. And they're trying to cut down on the number of errors, I guess, having to reissue the death certificates and clean up the errors. If you would like further information on this, I'd be happy to ask them to come before the board. I just wanted you to be aware in case you received any comments or calls on the matter. If you want to, if anybody would like that, let me know. We can put that on the agenda. Item F, there's really nothing to report here other than from when on the report concerning Martin Community Action that had come before you, I believe it was your last meeting. Immediately following that, myself as manager and the manager of Martin and Beaufort met jointly with the director, Bernadette Yarborough of the Martin Community Action, as well as their fiscal director, Connie Phelps, and then their board chair, and tried to vet out. We actually, the three of us came up with a long list of questions in writing that we asked them to be prepared to answer. Some of those they did bring to the table. Others they're still going to have to compile and bring back. So at this point in time, there's no recommendation on this. We're waiting for that information to be provided to us. And I think one thing that we were all in agreement to was that from a manager staff perspective was that one county wasn't going to do anything unless it was contingent upon the other county doing something. So if Pitt said we'd do X, but then Martin said we're not doing anything, then my recommendation to you would be that we wouldn't recommend anything unless all three counties participated in some way. I have three other items real quickly. Wanted to report to you on the Winterville Convenience Site. Several meetings, actually several months back, you approved for a committee to look at the Winterville Convenience Site, and that was going to be pretty much a staff-driven meeting. I had written and communicated with the Winterville Town Manager, asking her to, if the Town Council would be in agreement to this. Finally heard back last week after a long period of time. They are willing to come together. However, what was communicated to me, they would like a town commissioner on that committee, which was, when this board discussed it, you discussed just having it be staff-driven. That being the case, I guess I'd like to ask the board, do you want a county commissioner to sit with staff on this issue or just proceed as directed prior to?
Mr. Gash, Mr. Chairman,
Yes.
you've worked with that group, haven't you, Mr. Gash?
Yes, I have worked indirectly, yes. I am very familiar with the issue, and, you know, if the board wants a commissioner, I would be happy to serve.
I would think Mr. Gash should be proper for that. If you need a motion, I make that.
Do we need a motion on that?
We can just go by the direction if that's, unless the board wants
You
to.
okay
vote
with
on
that,
it.
Mr. Gary?
I'm okay, sure.
Okay, thank you.
All right, quickly, two other items. The county staff has been working on and going through bond rating agency reviews with the three bond rating agencies in New York. This is in regards to the refinancing, refunding that we're currently working on. This has been before the board the last couple of meetings. You have an item on this agenda as well. We actually did all three of them via conference calls this time. Fitch, which is what we consider one of our more harder ones in terms of the questions and the depth of the review, did come back and reaffirm our rating, which was good news. And we're still waiting for the other two, but expect those to be reaffirmed as well. So that's good news on the county's financials and outlook in that respect. The last item, I received a call from Judge Leach at the courthouse last week regarding a drug court treatment program that they've been doing that's been state funded for a number of years. As he explained to me, that state funding is running out or is concluded. He would like to, he's working with the sheriff's office to apply for a 2-year drug treatment court program. And on that, it's going to have I believe it's a $50,000 program per year with a $15,000 match. The application was actually due last Friday on this, and I went ahead and I guess the board could always turn it down if you didn't want to receive it, but actually it's a very good program working with these type of individuals. This cash match, again, is $15,000 per year for 2 years. Felt like we probably had sufficient cash match in the budget where we could identify it if funded. So if the board is okay with that, we will continue and proceed with that application. It couldn't wait till today, so I went ahead and authorized for them to submit it.
Mr. Chairman, whatever we need to do, I think most of us are familiar with the success of this program as it's gone on the last 2 years. So I, for one, who would be very much in favor of continuing that because I think it's made an impact on the community.
And actually, the existing federal grant will expire September of this year, and the grant they applied for is through the Governor's Crime Commission for this Pitt County Drug Treatment Court.
Do we need a motion on that?
But yeah, it would help to.
Is that a motion?
Yes, I
Do we have
make
a
that
second?
motion.
Second.
One question.
Mr. Garrison.
Have we been partially funding this in the past?
My understanding is no, that it's been all state funding.
So this is, I'm going to support this. I'm going to vote for it because it's a good program. But it does violate the first goal we expressed to our legislative team last Friday, because this is the reneging of commitments from the state level, and we are having to pick this up. I know it's only 15,000, but still, it's a violation of that principle.
Well, I think that was for mandates. This isn't a mandate. This is something we can opt out of. We don't have to have the drug courts, but as you know, that they're effective. But you're right in that the state is reducing money here and there and everywhere.
It's a mandate if we think this program is valuable enough to continue, and we do. So it turns out to be the same thing.
It's also a goal with the association to have those funds reinstated, so hopefully we'll be successful in the legislature.
Okay.
To help that out and mitigate that.
Good.
Mr. Chairman,
Yes, Mr. Colson.
I don't know, maybe everybody up here is more familiar with it than me. You say it was worthwhile results. Quite frankly, I don't know what those results are. I would like to postpone the actual voting on this until we get information as to how much of a success it is, because otherwise I will vote against it just on principle.
Is that a substitute motion to table?
Well, okay, if I need to make that substitute motion, I will.
We could bring back a report, and there's really no harm in delaying the vote on it. We could bring back a report, have the sheriff's office, and possibly even Judge Leach come and make a presentation to you on this topic at the next meeting.
I want to know, I read the program that was presented in the NACC, that little newsletter we get that relates to a drug program. Is it similar? I know I'm a new member here, but is it similar to the one in there, or is it a different one other than what's explained in that?
Yeah, it's similar. It's a drug
Similar?
court.
Oh, okay, because I didn't have any knowledge about it, and I was trying to think of it.
We have a motion and a second, and a substitute motion to table. Is there a second for the motion to table? All right, that fails for lack of a second. We'll vote on the original motion.
Would the board still like a report on this from the?
Yes.
Okay. Mr. Chairman, that's all I had.
All right.
I move for acceptance of the items on consent.
We've got a financial report from Mr. Holder.
Oh, I apologize, Mr. Holder. I'll hold my motion till you finish.
You can go ahead.
No.
I would not be offended. Good morning, Chairman Webb.
Good morning.
To the entire board. You do have in closing your packet the December 2014 monthly financial report for the general fund. At the midpoint in the fiscal year, happy to report that our revenues have been collected at a rate of 58.9% of anticipated revenues, and we've spent right at 48.1% of our budgeted expenditures. The only other thing that I will point out is that our current fiscal year 15 revised budget represents a 2% increase over our prior year fiscal year 14 budget, and our revenues in excess of expenditures is right at 2% more this fiscal year than it was last fiscal year. So that would just indicate that as your budget has grown incrementally, your revenues over expenditures have grown at the same pace. So those are good indicators that would suggest that we will see similar financial year-end numbers to the prior year.
Any questions for Mr. Holder?
Motion to approve.
Second.
Thank you. Ms. Elliott?
Yay, this was gonna be my helper, because I've not used the system before.
Just pull the microphone down.
Yes, ma'am, I know I'm kind of low to the ground. So anyway, thank y'all, good morning to you, and thank you for the opportunity to discuss what's going on with NC Fast at Pitt DSS. I know that you were briefed, or at least I believe you were briefed at various points during the implementation of NC Fast with our food stamp program and the problems that existed there. That, of course, was before my time, and a lot has happened since that. First, I want to say thank you, and by the way, all y'all have a handout that covers this PowerPoint. I want to say thank you for the 28 new positions that you did authorize for the public assistance program. That has been a big help, even though we don't have all those positions on board yet and fully trained. We do have 24 staff that have been hired to date, and they are doing applications and reviews for the agency. We partnered with Pitt Community College to set up the CRC testing, because they came in, studied the program, how we do the job, and evaluated and determined what kinds of things we needed through CRC testing, and we are now using that. Locating information, reading for information, and applied mathematics were the three things they identified as being most critical. This is, obviously, we can't mandate that folks have this certificate, but we are asking for folks to voluntarily do that. And the folks that we are seeing those scores with have really been a real asset to the agency. The first phase of the NC Fast program, which was the food stamp program, was completed pretty much in the spring of 2014. And their applications and reviews in the food stamp program are current as of this date and have remained current for a goodly period of time. The next slide you see is about case information, caseload information, or what the agency workload is like at this point in time. In the past year, our food stamp caseload has grown by 1,900 cases. Our Medicaid caseload has grown by almost 8,000 cases. We are currently processing an average of 900 food stamp applications per month with our staff. We are processing an average of 1,892 food stamp reviews a month. We are also averaging 581 Medicaid applications completed monthly. And just a new little quirk, besides the ACA, the Affordable Care Act, we're now getting applications for food stamps through TurboTax. So when you do your taxes, if you use TurboTax, we may be getting an application. We got 31 applications Thursday faxed to us via the TurboTax system. That's a whole new thing for us. We have boots on the ground. We have 39 people that are assigned to take and process applications. 4 of those positions are outposted, 3 at the hospital, and the hospital pays the county share of the cost. 1 is at the Bernstein Center. Those 4 folks can only do the work that's generated through where they're posted. We have 31 positions that are allocated to do reviews for Medicaid, food stamps, Work First, et cetera. So not all those positions are ever filled at any one time, because we have vacancies, family medical leave, those kinds of things going on. If you remember with food stamps, I think there was a fair amount of discussion about training and what needed to be done from a training standpoint. So training was a big issue. We did establish a training unit with a trainer and lead worker this year. The training room has been set up with equipment. Training for existing Medicaid staff has been ongoing. We are cross-training our staff to do both the programs so they can do everything. Our intake unit is pretty much universal at this point. They do everything. We have done training for our new hires in these groups, 10 at a time. And from time to time, state staff have come in to help us with a little bit of additional training, particularly when we did the hard launch for the Medicaid program. So now I'm going to go to what I call NC Fast Phase 2, which has been Medicaid. On July 1, the first county started hard launching into NC Fast with Medicaid. The state was concerned when that happened because they had over 104,000 past due Medicaid applications at the end of May. Pitt County had 2,277 past due applications. So there was a big push by the state at that point. We were focusing on applications. Let's get those applications done. By October 15th, Pitt County had 199 overdue applications, so we made significant progress with that. And it's fluctuated a little bit, and there are always reasons for some things to be overdue. So the first group of positions that we hired from the 28 that you gave us were put into the application area because that was the area that we were feeling the pressure on at that point. All applications had to be taken in NC Fast starting in August 1. And again, in Pitt County, our hard launch for NC Fast was November the 3rd, which meant we had to quit using the other system and do everything in NC Fast. We were one of the last counties to phase in. There were multiple phases, and we were in that last group of 24 counties to come in. So all of the old eligibility programs, all the old cases that were in the eligibility system have to be converted to NC Fast. The state did a small amount of that for us when they did the conversion, but the case basically needs to be rebuilt in the NC Fast program. That takes about an hour per case. And you know, it just dawned on me that Commissioner Farley may not know what NC Fast stands for. It is North Carolina Families Accessing Services Through Technology. We throw out acronyms and we forget folks don't know that. So that's kind of what's happened with applications. We are on track and doing what we need to be doing with applications. In July, I started work here in July, and so in July we were looking at all our numbers and trying to see what we were getting done, and again, applications were the big push at that point. But in looking, we realized the next crisis was going to be reviews. There were over 600,000 statewide reviews that needed to be done by December the 31st. Pitt County had 11,073 of those reviews. The reason there was a review crisis was the state was very helpful. Because of everything going on with NC Fast, they said, and the counties thanked them profusely for this, was that we were going to automatically roll forward every review that was not completed timely so that those folks would not lose benefits. Well, if you started doing that in January and you rolled every case that wasn't completed forward, you have a huge number building rapidly. So we had 11,000 that were due, like I said, from August to December 31, which was the deadline. As we got closer to December 31, the state extended that to March 31. So we had to March 31 to get all these reviews done. Between August 1 and October 30, Pitt County managed to process 6,145 of those cases that needed to be reviewed. And then another 2,682 were done after our hard launch. So you can see we slowed down considerably. Part of that was due to the holidays. We did not have overtime during that period of time. Part of the time was just the process of the converting of the cases and the lack of familiarity, even though we had been practicing, the lack of familiarity in the review units with NC Fast. As of our January 30 report, as I said, we had 2,682 that had been completed. Over 1,000 of those were done in the month of January. Now, and 436 of them were done within a 3-day period. So we have obviously figured out a way to work on this problem. We have 7,962 as of our January 30 report that still need to be completed. That's a scary figure. Statewide, that figure is in excess of 400,000. What I also want to say to you is the state projects now, based on all the growth, that our normal review amount each month is going to be about 1,900 cases. That's about 300 to 400 more per review month than we had in the past. State has also identified the top 3 barriers to getting the job done at this point. The first one was NC Fast functionality. It's been slow. There have been a variety of issues. The second was training needs for new hires. And the third was staffing. And Pitt County was really great because they stepped up to the plate in July. Wake County just recently authorized 85 new positions. Other counties are doing that same kind of thing. So everybody's out there trying to get the right match for the numbers that they're going to need. So, after our board meeting in January, when we talked about the fact that we were having some difficulty and that we were looking at a new plan to try and get this done, there were a lot of questions, obviously, and so let me say first and foremost, we are not asking for any additional financial resources from the county to get this done. We believe we have the resources to do that in our budget as we speak. We did some reevaluation of our budget, believe we can find some dollars to cover anything that we might need. Secondly, on January 2nd, we reinstated mandatory overtime of 8 hours per week for all staff. That is where some of our cost is going to incur, because at some point, we will get to the point that we're going to need to pay out some of this overtime. So that will be one of the costs. We decided to divide our staff into 2 sections that are doing reviews right now. And because some folks are still struggling with the NC Fast system, and some folks have caught on very quickly. We have decided to divide it between the folks who really know how to work the system, let them key cases, and those folks that really know how to do Medicaid and know how to do the policy, let them get those cases processed and hand them to somebody to key. This is not a long-term solution. This is a short-term solution. And as I said, we did over 400 cases the first 3 days we had this up there. So on the last report I looked at, we did 186 on one day. So clearly that is helping us. And I can, in the slideshow, we've got how we've got folks divided out. The part-time is 8 hours of overtime. That's what we're calling part-time. That's where our food stamp workers and our applications workers are helping us, because they are working the part-time, the overtime, to help the review staff. In February, our 9 newest hires will begin keying data for us so we can then shift things again. We'll have additional folks key and additional folks process, and as a result of that, we also want to thank the Register of Deeds, because she is transitioning 2 positions to us for the short term to help with some of the data entry issues. So we believe with all of that, we will be able to meet the deadlines or be very close. We also are going to ask, or have asked for approval to bring back a few of our retired staff who can talk to the people who are calling us with questions. That would then allow the staff that are trying to key and process to keep their focus there and not have lots of interruptions. We constantly need to adjust. Every day we look at things, we make adjustments as we need to. Our goal is that nobody loses coverage that they are entitled to. I will say that once we get through this, we need to process 95 a day ongoing to meet what our expected caseload will be. That is certainly doable. If we do not get this done by the deadline, what I can say to you is that we can manually extend coverage if the state doesn't automatically do that for us in the future. We can manually extend coverage on a month-to-month basis until that case is processed. We don't want to do that because that's double work. But if we have a small group of outliers out there, that is what we can do until we can get those processed. So that's kind of the status of where we are with NC Fast, and I will be happy to take any questions or try to answer anything anybody's got.
Does anyone have any questions for Ms. Elliott? Mr. Garris.
Sounds to me like that you and your team have done a very good job in trying to get us in a reasonable place. Of the 28 people that we approved, you said you've hired 24. Are you still looking to hire the other 4? Or do
We
you
will
not
be
do-
advertising for some additional folks, yes. We've got more to hire. When we we could not bring all 28 people on the same day, clearly. That's a training issue, a room issue, an equipment issue. So we are bringing them on 10 at a time. It takes about 3 months of classroom training typically. And then we put them in a reduced caseload for another 3 months where we do 100% checking of all their work so that they're making sure they have learned the policy correctly. And then we kind of turn them loose to a full caseload. So we've had folks phasing in during this transition.
Thank you.
Mr. McLaughlin?
You mentioned TurboTax's application in terms of food stamp recipients. Is this the first year that this has been
Yes,
done?
sir. Yes, sir. And there's going to be a conference call, I think, today with TurboTax and the state level folks to find out what's going on. And what is really interesting is our state head of economic services did his TurboTax, and they suggested that perhaps he might be eligible for Medicaid, and would they like him to forward his application. So it does not have enough information to make a good referral, but we have to go through those and figure out what to do with them.
And this will be a continuous.
Well, obviously, we are very hopeful that the conversations that the state's having with the people who put out TurboTax will make some progress in maybe not having this continue. But if it does continue, it would be through tax season, yes.
Anyone else? I've got a few questions.
Sure.
Is this going to be paid through comp time?
Well, right now, we're just saying comp time, but if it bills significantly, then yeah, we'll need to pay out that comp time.
Because I hate to just say comp time, because that's a huge unfunded liability
It is, and that's
for the
why I'm
county.
trying to, yes, sir, that's why I'm trying
I
to.
think part of the plan too is to look at those comp time balances, and I think Ms. Elliott was referring to that they would probably, through lapsed salary, we would pay down some of the comp time balances.
But that'll run out some once you get these other people hired, correct?
That will. Clearly, my goal is that once we get all these folks trained, and we are moving rapidly in that, but once all these folks are trained, then that comp time should go away. But we do have a time right now that and if I, having not been here, but I understand there was a tremendous, amount of comp time going on through that food stamp transition. And we did, in fact, do paid comp time in the month of, I want to say October. 1 month we did paid comp time. I think it was October for those folks because they were working so hard. But we are using lapsed salary to pay that, and it is reimbursable. So the county's cost, there's no additional county cost to that other than what's been
75% on
budgeted.
average.
Okay. And, but this is, you said mandatory every time, so people are having to give up weekends?
Right now, yes, sir. Okay. Everybody's got to pitch in.
What's our time frame for getting it done?
We've got to have it done by March 31, which
Will
is
we?
what the state, we're going to be close. I will not stand here and, go, yes, sir, we will be done. But what I will say is we're going to be extremely close, and my goal is to be done.
And I know y'all are working hard, and honestly, any government program with an acronym that long, I don't expect to work. But, I know that we got a lot to do, but I'm trying to also shield the county from
Exactly.
huge unfunded liabilities. And it comes to liabilities and things, that if you'll let me pivot to something a little different for just a second, the board will give me some leeway just because I've got you here.
Yeah.
How many, this is a foster care question, how many kids do we have in level 1 group homes?
I can't answer that question.
Roughly-
Angela, can you answer that question? 100 in level 1 group care, level 1 homes.
Level 1 homes, that's,
This is the finance lady, so
Oh, great,
she's who tracks that every day.
so that's about $4,500 a month on average. Is that county money or state money? Because if,
Combination.
but the level 1 is very minorly reimbursed to state and federal. So the bulk of it's county dollars, which.
That's correct. Yes, sir.
So I'm not that good at math, hold on.
Yeah, I'm not either. That's why I'm a social worker.
But that's why I'm a police officer.
Oh, Lord. I trust people like this to keep me out of
So
trouble.
that's $450,000 a month.
Is that right?
$5.4 million a year. If we have 100 in there at $4,500 a
That
month,
sounds too high.
That's too high.
That's way
That is too high.
$4,500 a month times 100 kids equals $450,000.
Now, some of these children, even though they are in that level of care, we have been able to negotiate the rates with the foster care providers. So some of them will take the standard board rate, which is $634. A lot of them are, our social workers are asked to negotiate those rates so that we don't have to pay that really high rate. And they have been able to do that.
So how much do we pay a month? And the reason I ask is this, is because level 1 group homes are non-therapeutic, and a lot of these kids need some kind of help, and they're not getting it there. And so I just wonder why we aren't using Easter Seals or ECBH, whose starting rate is a third of that at about $1,600 a month. And then once they're leveled, it drops down to the $634, which is the difference between, if you got 30 kids, that's about $1.6 million a year, or in my mind, the new wing of the jail, versus $228,000 a year. And I'm just wondering, why are we using these homes for kids that need treatment that's just basically a bed?
Mainly it's due to funding, and also the fact that ECBH takes an average of 2 to 3 months to actually get these children leveled so that they can go to that lower rate. And most of the children that come into care come in on an emergency basis, and we have to find them a bed to stay in.
So are they staying there long-term, or are we moving them as soon as possible?
It's short-term. They move them as soon as they can.
Okay. Are you familiar with the Casey Asnell Fund and what that does?
I'm not familiar
I've
with
never
it.
heard of that one.
Also known as the Links program?
Links.
Oh, yes,
sir.
links.
What's, just briefly, am I correct in that, and this will be my last line of stuff here?
Sure.
Is that to help transition kids that are coming out of foster care?
That's to help transition the kids who are aging out, yes.
So-
what we do with those kids, we can help them with education, we can help them with a place to live if they're, don't stay in the facility that they're in. It provides a variety of transitional kinds of things from a cash standpoint, as, in payments, as well as providing support services to them.
Will that include vacations to Disney World?
Not aware of that. Now, sometimes we have foster parents who go to Disney World and take kids. We also, there have been conferences for some of the Links kids where they have there's an organization for the Links program, and some of those kids go to some of those meetings. Now, I do not remember if one has been at Disney World. I do know we went to Colorado with 1 or 2 of our children for a special meeting. And that fund paid for that.
So to your knowledge, we've never sent 5 kids and 2 staff to Disney World on Links Fund?
Not that I'm aware of, but then I haven't been here that long.
Haven't been here that long, I understand. Are you aware of that at all?
We have, but there was an actual links conference activity that was going on there, and it was 100% funded through the Links special funds.
We sent 5 kids on
I think there
federal
were
money
5
down to Florida.
Right.
And paid 2 staff.
Right.
And they did go to Disney World, correct?
I don't know that they went to Disney World. They went to Florida. I'm not sure about
I just
Disney.
don't think
Had
it
I
would
been
sit.
there, I'd have gone to Disney
Sure,
World.
I understand. I just don't think it would sit well with taxpayers to know that money was being used for trips like this.
Well, but what I would say is that these conferences do a lot of really good for these kids. We have a couple of folks that actually are in leadership roles with this organization, the say-so and that kind of thing. And so this is a way for them to develop skills and to network. And so there are very positive kinds of things that are coming out of that. It's not just a meeting where they go have fun. Now, don't get me wrong, we're teenagers and we're going to have fun.
Sure,
But,
the perception is what I'm talking
Right,
about.
I understand the perception.
And especially kids that are in our custody, that aren't getting waivers signed, I'm assuming, that we're actually responsible for.
Well,
I won't belabor this any longer. I'm just saying, I don't like the way it looks. I'd like to see a printout of the expenditures, actually, if possible, when available. Ms. Ward?
The TurboTax, how long have we processed one of those? How long does it take to figure if what the information they have is correct?
Well, initially, we've got to contact the people.
And bring them in.
And, well, at least have a conversation with them over the phone.
Well, what I mean is
And we get the same kind of thing over the Affordable Care Act portal too.
Okay.
People that wind up getting referred for Medicaid. And you gotta contact them to assess what's going on. And a lot of those folks are not eligible for Medicaid. It's how things are counted and whatever, but it does take time.
15-minute phone call, 30-minute
Probably 15, 20, 30-minute phone call would be a fair
And if you find
statement.
out they
if
do
we can-
qualify, you've then got to process
Then
it.
you've got to process their
Okay.
application. And I will
Thank
say
you.
right now, most of our applications are coming in over the internet.
Thank you, Federal
ma'am.
You don't have any other questions? All right, thank you.
Thank you.
Entertain a motion on the consent agenda.
So move.
Second.
Vote Dave.
Mr. Lee?
Good morning, Mr. Chairman and Commissioners.
Good morning.
Still fighting a little bit of a head cold, so if I sound a little stopped up, just understand. This morning, we're coming to you to ask permission to actually go ahead and release an RFP for computer aid dispatch, or a CAD, for the 911 center. We're currently working with the system we've had since 2005, and it was developed in-house by our MIS department. It's worked good, but we're still at that point now, and we've worked with Mike Taylor and his group in trying to develop this RFP. With your approval of allowing us to release this RFP, we would plan to properly advertise this and release it on February the 14th with the return date of March 25th. We would then take that RFP or those proposals as they come back, review it by county staff, try to narrow it down to what we feel like meets the requirements, and then send this to the 911 board to say what are fundable items, so that we could come back to you as commissioners so that you would know actually what would be the cost to Pitt County. So, Mr. Chairman, I am asking if you will allow us to release this RFP.
It's a pleasure of the board.
Mr. Chairman, this looks like this has been thoroughly vetted with our MIS section and our 911 system, and it is just to approve the release of the RFP, so I would make a motion that we approve it.
I second it.
Thank you.
Mr. Chairman.
Sheriff?
Hello, everyone.
Good morning.
We're here today for the budget amendment request for the DV Homicide Prevention Initiative, and I understand you guys had a couple questions about the budget. When we originally wrote it, it was for about $450,000. Because this is a demonstration initiative, not a typical grant, OVW, Office on Violence Against Women, reviewed all the 4 projects that were selected nationally and decided that they needed to increase the budget to provide for more activities that they would like us to accomplish. So the budget is now $650,000. And we have submitted our budget to DC, and it's still under review. We've got a couple things we're trying to work out, but we needed to go ahead and let you guys know that the budget is now $650,000. And we've been working with Denise in the finance office to give her our budget as it stands today.
And all of this is being funded by a grant, correct?
That's correct, it's 100%, yes.
Okay, so I make a motion we approve.
Second.
Does anyone have any further discussion?
I've
Mr. Colson.
got a question.
Mr. Colson and Mr. Oaks.
Excuse me, go ahead.
Well, Mark and I talked about this. What's $162,000 for UNC Chapel Hill? What's that?
Yes, that is a key component. That is one of the reasons that Pitt County, North Carolina was selected, because this is an initiative to determine whether or not the specific homicide reduction model will work in other communities across the nation. And obviously with that comes research and evaluation. Yale University and Michigan State University were selected as the national researchers, and they are working with our researcher at UNC Chapel Hill. Her objective will be to come to Pitt County and collect data on our law enforcement implementation of the model and also the victim services piece of this. We need to find out, is it working? Does it work for a community our size? What are some of the challenges? What are some of the weaknesses and advantages? And can this be replicated in other areas? So that's a key component. We're not researchers. We're not evaluators. We're law enforcement. So you've got to have someone to conduct that evaluation piece and then work with the national researchers.
Well, I know everything's got to have a name, and there was a time years gone by where there was a budget line item that was called professional fees, and after dug into it, we found all kind of things that, you know, it was real convenient to call it that. So having said that, what is contract services?
That's just a grant category. You've got personnel, you've got fringes, you've got supplies, equipment, and then you have what you call contractual services. And that's anything that the County of Pitt is going to contract that's not internally. So in contracted services, you're going to find that contract for UNC Chapel Hill. You're going to find that contract for GPD to do some overtime to receive this training, and also for the Center for Family Violence to receive the victim service coordination that they need.
And then one last thing is, I know it was stated that this comes where the money comes from, but I'd like to again remind everybody, this money is coming either from the federal government or state government, and it's the taxpayers that are paying for it. And right now with the federal government, they're printing paper. Thank you.
Mr. Owens? Let's go back up to the salaries. Is that for a director? Maybe I know this and just forgotten it. But is that one director locally, or how's that $94,000 spent?
Yeah, that's an employee that we have that was attached to Phase 1 of the project and was funded through the grant during Phase 1. We actually had 2 employees, if you remember, and now for Phase 2, we just need 1 to coordinate the program.
Now, what do those 2 employees do? You might have told me before.
They're domestic violence investigators.
Ma'am?
Domestic violence investigators.
All right, now getting back down to the 3 things that Tom mentioned. You mean from this grant, you send a check to Chapel Hill for $162,000 for evaluation?
This is for 2 years. Yes, that's correct.
All right. And to the Center for Family Violence, is that within the county or is that sent somewhere else?
No, that's the center that's here in Greenville.
All right, and of course, this contract service, what did you tell Tom that was?
Yeah, that's it. That's a new one, and that the technical advisors that are attached to this project, they're going to come down to Pitt County and they're going to assess what resources we have for underserved populations. Those are individuals that are not likely to come and seek services. They continue to be abused. They've got some type of fear of law enforcement, or they're not familiar, they're not committed to getting victim services. We're going to have individuals, agencies that are going to be able to provide them the services that they need. I don't know who those agencies are yet. The TA providers, when they come down, they're going to assess where our weaknesses is.
One more, the travel general fund, is that paid back to the general fund for the county, or is that within your department?
Which part is that?
The $12,000 for travel?
That'll be internally.
For
That'll
the
be for
two
our-
employees that you listed up above?
Everyone that's on our team, and there's about 5 of us.
I believe we went over this before when you had this, but I just have a question in my mind. When you're getting $650,000, if you're getting, and I'm not arguing with you, but if you're getting your best money for what you're getting, but when you send this $162,000 for evaluation at Chapel Hill, of course, I love Chapel Hill, but that bothers me. And I'm sure that you and those 2 people that you hired and the sheriff and all are spending the taxpayers' money efficiently, but it behooves me that I'm to try to question that too, and that's the reason I'm doing this.
Well, we have to have a researcher. This is why we're part of the initiative.
Thank you.
Could I
Good.
just ask who designated Chapel Hill to do the research?
Our agency did. We've worked with UNC Chapel Hill, the specific researcher on human trafficking issues. You're familiar that we've been very involved with that, and also other domestic violence researchers.
I didn't know whether it was
That was a
or whether
key-
they
that-
had a background and that sort of thing.
Absolutely.
And I know you have to go with people that have previously had some experience in this, like Chapel Hill, if you get it passed.
Absolutely.
The powers that be and get the money.
And
Thank you.
just to clear a few things up, Melissa, the grant money is just to get this going. Like, once the program is rolling, we won't be giving $162,000 out of the county's budget to Chapel Hill, another 50 to Greenville, or the 140 to the family violence. This is just to establish the need and to show our stats here, correct?
This is to actually implement the model. As you remember, we went through a very rigorous 1-year, evaluation, community assessment phase. We were one of 12 sites that were selected to do that. Once they reviewed all the information, they looked at our final plan, and they selected us as 1 out of 4 in the nation. This is huge for Pitt County. This really is. This is going to implement this model, and hopefully we won't have any more men and women that are killed by their spouses or their intimate partner. And a large part, like I said, you have to have that evaluation piece. And so we've really worked really hard on this. And you're right, this will not be an ongoing program. Well, the model will, but the staffing and the research, it will end. And the National Institute of Justice, we're very, very proud to be selected by them and to be part of one of their studies. That does not happen very often at all. And so Pitt County should be very happy with that. And so they'll spend, it's actually going to be 3 years. They'll spend the next 3 years looking at our data and everything that we've done pre and post this project. And they'll be able to say whether or not this can be replicated in other areas. And this is going to be based on what they see in Pitt County.
Great. Mr. Manager, you had a question?
Yes, Melissa, once the federal funding runs out, how much do you anticipate it will cost locally to continue this program moving forward?
From the sheriff's office perspective, just perhaps maybe that full-time staff person. It's unsure at this point how much, well, let me explain it to you this way. Part of this model is to teach law enforcement officers to implement a tool that they will use when they go to a domestic violence call, determine whether or not this particular victim is at risk for being killed by their partner. So this is just a change in the way we do business. It's not necessarily adding more officers to the street, anything like that. This is an initiative, a model on how you're going to do your business. So I don't think 3 years down the road we're going to necessarily need that coordination that we need at this point.
Thank you. Ms. Williams, did you have?
I was wondering if it was something that the county would have to fund in the future, even though domestic violence is a very serious issue here in the county. I was just wondering if it's something that would be funded by this county in the future, beyond the 3 years perhaps.
Right. Once the model is implemented, we should not have to have the further funding. You know, victim services funds are always needed. There's no doubt about that. We have more victims every year than we did the previous year. That's not going to go away, unfortunately, as part of this initiative to hope that we can reduce that. But unfortunately, it is a crime that is very common.
And the cost is going to be similar to what we're seeing here?
No, after this 2 or 3 year funding is over, the model will be implemented, and there should not be the cost that you see associated. We won't need to do the research, for example. We may not need as much coordination as we need at this point while we're doing the implementation.
All right. Well, thank you for your presentation. We thank you for getting this recognition, this nationwide. You said 4 in the nation?
That's correct. One in Brooklyn, one in Ohio, and one in California.
Wonderful.
And just as a side note to your earlier conversation about drug court, we would love to come and give you a presentation, and Judge Leach would love to do that also. So you just let us know when, and we'll be here.
Great. We'll look forward to it. Thank you.
Thank you.
Thanks, Sheriff. Mr. Cowan and Madam Attorney? Oh, yes. Let's finish our vote on the grant. Mr. Colson, Mr. Hammond, and Ms. Williams on the grant motion. Ms. Cowan, I assume you're here to give us money? No?
You leave me speechless. Thank y'all for the opportunity to come speak for you today about some things we have going on with our school buses, specifically our activity buses. We have over 27 activity buses that are over 25 years old with well over 150,000 miles. We have 7 that are even older than that, and we have an opportunity here to purchase some activity buses with our local Category 1, 2, and 3 funding, the same way we purchase our yellow school buses through the Department of Public Instruction. The Department of Public Instruction allows for the purchase of yellow school buses through a leasing agreement that's funded by the state. And we usually receive up to 5 to 10 school buses at a time. What we're asking here today is to allow the board to allow us to use our Category 1, 2, and 3 money to finance the purchase of 3 activity buses, so we can go ahead and get them into our fleet and retire some that have, again, well over 25 years of service and almost 200,000 miles. We have within our Category 1, 2, and 3 budget the dollar set aside on an annual basis to make this leasing agreement. Matter of fact, that's how we've been purchasing activity buses over the past years, is the use of Category 1, 2, and 3 fund to replace one. Given the fact that we have so many that are old, this is just an opportunity to improve student safety in the vehicles they're being used to transport students from one event to another. Being able to replace 3 basically at the same cost over a 4-year period, that we could replace one at a year at a time makes more sense to us from a safety perspective. So that's why we ask that you approve this resolution. Again, not really costing the county any dollars. This is we pay for this out of the $750,000 we receive from you on an annual basis for Category 1, 2, and 3 funding. And this would be solely out of our use of those funds on an annual basis.
Thank you. Any questions? Pleasure of the board.
Motion to approve.
Second. Mr. Chairman, I have something.
Discussion, Mr. Colson.
Now, you're saying $750,000, but it's over a 4-year period? Is that $750 divided by 4, or is it $750
No, it's approximately about an $83,000 purchase amount. So we're only using $83,000 of that $750,000 on an annual basis.
Okay, so total cost would be
Total cost,
about
$83,000 times 4. It's about $325,000 worth of payments, of which $3,300, only $3,300 of it is interest. So for $3,300 in interest, we're able to get those buses up front now.
Okay, for anybody listening to this, should the resolution be read so that they know what we're actually about to vote on?
Is that it?
Yeah.
What's that?
We have to read it if you want me to.
Yeah.
Okay. Chairman Webb's asked me to read the resolution. It's entitled Resolution Approving Continuing Contract for Capital Outlay for Pitt County Board of Education. Whereas Pitt County Board of Education has entered into a contract with IC Corporation and Bank of America to purchase 4 activity buses, which will be paid for in installments over a 4-year period between fiscal year 2014-15 through 2017-18. Whereas Pitt County Board of Education has the authority to enter into continuing contracts for capital outlay expenditures pursuant to NCGS 115C-441C1. And whereas the North Carolina General Statute, as cited, further provides that continuing contracts for capital outlay expenditures by the Board of Education be approved by a resolution adopted by the Board of County Commissioners to assure that sufficient funds are appropriated in ensuing fiscal years to meet the amounts to be paid under the contract in those years. Whereas the Board of Education intends to make annual payments up to $90,000 for activity school buses as a Category 3 expenditures from funds appropriated annually by the Board of County Commissioners for Category 1, 2, and 3 capital expenses. Now therefore be resolved that the Pitt County Board of Commissioners hereby approves the continuing contract for capital outlay along with the purchase of 4 activity school buses by the Pitt County Board of Education. Be it further resolved that the annual expenditures associated with this Category 3 capital expense be paid by the Board of Education from funds annually appropriated by the Board of County Commissioners to the Board of Education for Category 1, 2, and 3 capital expenditures.
Everybody okay with that?
Yes.
As read, with motion second, we've read a resolution. Any other discussion? All right, let's vote. Mr. Hammond. All right, thank you.
All right, thank y'all.
Mr. Holder.
Good morning again.
Good morning.
What we have before you are 2 resolutions that are required for us to continue in our process of the refinancing of Series 2004B, 2007 jail, and 2007 schools certificates of participation. We are terming this refinancing 2015 limited obligation bonds, or LOBs. So for our 2015 LOBs process, these 2 attached resolutions are required to continue in the process. The first resolution is a resolution approving and authorizing the execution and delivery of a master trust agreement, a first supplemental trust agreement, a deed of trust, and certain related documents in connection with the refinancing of certain outstanding installment financing obligations of the county. And the second resolution is a resolution requesting the release of certain real property from the lien created by an existing deed of trust and authorizing the amendment of an existing lease agreement relating to the D.H. Conley High School. Remind the board that our 2004B certificates of participation are currently secured by both D.H. Conley and Hope Middle Schools. And what we are proposing to do is to release D.H. Conley High School from that 2004B Certificate of Participation in Security, leave Hope Middle School as security. It will suffice as security for the remaining portion, because there is still a portion of the 2004B that will not be refunded. We will utilize the D.H. Conley High School as security, sole security for the 2015 limited obligation bonds. I'll also remind the board that we will not, with the 2015 refinancing, we will not be extending the life of any of the securities. And we do anticipate right now, with current market conditions, that this savings will be approximately $2.6 million in gross savings, with an average savings of approximately $148,000 a year. And about 50% of that will be savings to our restricted schools capital construction fund, and 50% of that will be for the general fund.
Mr. Garris?
Mr. Chairman, this is something we discussed at our last meeting and had a public hearing on it, and as Mr. Hollis pointed out, this could save us over the life of this security about $2.6 million. So I make a motion we approve both of these
I'll second
resolutions.
it.
Motion is second. Any discussion? Mr. Owens?
Mr. Garris is correct. We did review this and we approved the process of it. But we have within this documentation here that we're going to sell bonds again. Now, the bonds have not been sold, have they?
That is correct.
All right. You can get up to $40 million for refinancing. Is that correct?
It's a not to exceed, correct. We
Up
anticipate
to
right now
40,
about
like you see,
34.
But for $40 million, how much are we going to be owing after we sell those bonds, the amount? Do you have any idea what that is, Dwayne? For
Well,
the two or three projects, I know you're making the
right.
accommodation.
We don't anticipate going up to 40. Right now, we anticipate about 34.6 million.
34?
Yes, sir.
If you'd write a check today, you could pay off this indebtedness for 34 million, correct? Is that what you're telling me?
That's the outstanding par currently.
All right, thank you.
Any further discussion? Let's vote. Okay, Mr. Elliott, reappointments.
Yeah, Mr. Chairman, board members, page 67, you have reappointments to the Vidant Medical Center Board. And basically, the two reappointments they are recommending, we have a letter from the chairman of the Vidant Medical Center Board, and they would like the board to consider reappointing Joanne Bergdorf and Bryant Kittrell to this board.
Mr. Chairman?
Yes, sir.
Motion to reappoint Joanne Birdall and Brian Kittrell to the Vidant Medical Center Board, please.
Second it.
Any other nominations? Let's vote. All right. Commissioners' comments, we'll start with Mr. Hammond. Any comments? Ms. Williams?
Yes, I have a comment that I have an information office in the district, and we will be having an open house for which all of you are invited, and the general public, to receive concerns, complaints, and anything else the community want to bring. It is what they wanted me to do. And it's at 2197 Old River Road, and the open house will be this coming weekend, beginning at 4 o'clock to 6, and on Saturday from 10 until 4. You are all invited.
10 to 4 on Saturday?
Yes. 2197 Old River Road.
What they call that?
They're calling it Northern Pitt County Information Center.
Commissioner Perkins Williams, it's Friday the 6th from 4 to 6, and then Saturday the 7th from 10 to 4, is that correct?
Yes.
Okay.
Thank you.
Whatever it is.
Mr. Colson?
None.
Mr. Owens?
I think everybody ought to go and pray with Mary on that Saturday from 6 to 4.
I think so.
Thank you, Mark.
Thank you.
we accept all prayers.
Ms. Ward?
No comments, thank you.
Longhorn?
No.
Garrett?
comment.
Farrell?
Yes, I'd like to mention how much I enjoyed that presentation about net metering. And the last meeting that I went to with the Pitt Greenville Airport, they also had some concerns about the way they were being billed. So I will make sure this is a discussion point at the next meeting there. Thank you very much, Mr. Chairman.
Thank you. Have any motions?
So move adjourned.
Second.
I second it.
All right, thank you.
Warten Sie noch.